again, we're going to pick up with the chart 6 abbreviation. So we left off with hours of sleep. So that's your bedtime. So what time you're going to bed. Next one is capital H, lowercase t. That is height. Height, so how tall are you? In America, we measure everything in inches, feet in inches. Other places are meters and centimeters. Then HX. Can be capital H, lowercase x, or both lowercase. This is generally a history of the patient, so their medical history. Okay, so if you have a patient that's having an emergency and they're having difficulty breathing, some things that you might want to ask them is their medical history on things like COPD or chronic obstructive pulmonary disease or asthma, bronchitis. Okay. Anaphylaxis, are they severely allergic to anything? You are really needing a pertinent history to see what's going on with that patient. Hypo. So this is hypodermic injection. So this means going just below the surface of the skin, just below it. And we do a hypodermic injection for TB tests. And you kind of see it bubble up a little bit. But that is a hypodermic injection, meaning hypo, under or below, dermic pertaining to the skin. Hist is short for hysterectomy. So hyster or hystero is female, and ectomy is removal. So this is a removal of the female reproductive organs. So you can have a full hysterectomy where you have your uterus and your ovaries taken out. Sometimes they just take your uterus out or just your ovaries. It just depends on the procedure and what's needed. INO, this is intake and output. So like your heart, like you have cardiac output, so it has intake. So how much blood does it take in? And then how much does it put out? Okay. ICCU, it's kind of like an ICU, which is where it's an intensive care unit, but they specialize in cardiac care, so coronary, intensive coronary care unit. ICD, this is the International Classification of Diseases. So a long time ago, doctors got together and said, hey, diabetes can be diagnosed by this, 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 and this. Let's see what else. Leukemia, or cancer of the white blood cells, can be diagnosed by this, this, and this, right? So that's where they came up with the names for them, what characterizes a diagnosis. Also, it could stand for implanted cardiac defibrillator. So we've learned about an AED, right? You did CPR. AED, that's an automated external defibrillator. The ICD is an implanted cardiac defibrillator. Sometimes you can get a pacemaker that is also an ICD or an implanted cardiac defibrillator. It's important to know if somebody has one or not, especially if they're having difficulty with chest pains or difficulty breathing. ICU, we kind of already hit on this. This is an intensive care unit. Intensive care unit in ICU. This is where they take all of the patients that need extra care. Like a nurse may only have 2 or 3 patients in an ICU, whereas on a normal floor they could have 7, 8, 9. It depends on how much care the patients need. ID, so this could mean 2 different things. Intradermal, which is where it kind of goes into the skin layer, or infectious disease. So you can specialize as a physician in infectious diseases. If you ever watch House MD, he specializes in infectious disease. Okay. Then we have IDDM. This is insulin-dependent diabetes mellitus. So this is type 1 diabetes, where they need to inject themselves with insulin. And I found a little video clip on. There we go.
Hi, this is Karen Kraska from US Pharmacist, and this month's patient teaching aid is all about type 1 diabetes. In type 1 diabetes, the body is unable to properly manage blood sugar. There are two distinct types of diabetes, type 1 and type 2, where type 2 is the most common by far. And type 1 impacts nearly 10% of the US population. In fact, it's the most commonly diagnosed childhood chronic condition, and that's why it's often referred to as juvenile diabetes. Our bodies are designed to break down the sugars and carbohydrates that we consume into a more simple form of sugar called glucose. Glucose provides fuel for our cells and is necessary for healthy cellular function. The body requires insulin to serve as the key that opens the door of the cell and allows glucose to enter. In type 1 diabetes, the beta cells in the pancreas are destroyed, and the body is unable to produce adequate insulin. Beta cells in the pancreas are destroyed by the body's own immune system, and it isn't clear what triggers the immune malfunction. Though the leading theories suggest that a combination of genetic patterns and exposure to some viruses correlate with the onset of type 1 diabetes. Glucose accumulates in the bloodstream when there's not enough insulin to allow for it to enter the cells. This accumulation of glucose in the bloodstream causes the most common symptoms of type 1 diabetes, such as excessive fluid intake from extreme thirst, excessive hunger and ingestion of food, and frequent urination with high volumes of urine. And finally, very high blood sugar levels, called hyperglycemia. Despite being called juvenile diabetes, type 1 diabetes can occur at any age, but it's the most common chronic disease of childhood. It's important for physicians to identify which type of diabetes is causing symptoms, because the initial course of treatment is different between type 1 and type 2. Doctors will use blood tests to determine blood sugar levels and ketone levels, and then test further to identify the presence of antibodies in the blood, which would signify an immune reaction. For patients with type 1 diabetes, it's a 24/7 effort to maintain a healthy glucose range. Doctors, patient, and family will use a combination of medicine and lifestyle changes to manage a condition. Frequent and consistent monitoring of blood glucose is required, along with tracking of carbohydrate intake and physical activity. Patients with type 1 diabetes require lifelong insulin therapy. Advances in the introduction of insulin analogs have made it possible for patients to use fewer injections during the course of the day. To maintain a stable insulin level all day, a long-acting insulin is used once daily, with self-injections using a short-acting insulin that manages blood sugar spikes after meals. In recent years, the insulin pump was introduced. This allowed for automatic insulin infusions via a catheter that's placed under the skin. Also recently introduced is a device that automatically monitors blood glucose levels. When the insulin pump and the automatic blood glucose monitor are used together, it creates a closed-loop system that helps patients manage blood sugar with less effort and possibly less error. This month's patient teaching aid reviews the causes, symptoms, and treatments of type 1 diabetes. The teaching aid is available in our monthly publication and can also be found online at www.uspharmacist.com/teaching aids. We hope this month's patient teaching aid helps you in your daily patient education activities.
Okay, so I thought that was a really great video on diabetes. A lot of people don't really understand what insulin is or does, or what diabetes really is. All right, so we'll move on to IM. This is intramuscular. This generally refers to a shot that we give that goes straight into a muscle. So whenever you get a shot in your arm or a shot in your thigh, a shot in your rear, okay, those are considered IM shots, intramuscular. So insulin is an IM shot. We have an EpiPen, right? Remember that from CPR and first aid? That one is an intramuscular shot as well. Then we have IN. This is for inch. So we know that there's 12 inches in a foot, so that's how we measure length and height. Infusion, inferior infection. So INF has three different meanings. So an infusion generally is when you're lacking something in your blood and you start getting very sick. You can go for an infusion. Inferior means below, right? So if somebody is your superior, they are above you. If somebody is your inferior, they are below you. Then there's infection. Infection could be a disease, it could be a bug, right? You're infected with something, INF. Okay. INJ, this is for injection. So if you just have a regular injection to note, INJ. That one's pretty easy. It's right at the first three letters of the word. INT. INT could be one of two things. It could be internal or interior. So either way, it means on the inside. INT is inside. IRR or IRRIG is for irrigation. So you can irrigate a wound, which is where you rinse it out. They can irrigate during surgery where they rinse away blood or maybe parts of tissues that they've cut off, that kind of thing. The last one I'm going to talk about in this video is ISOL. It can be capitalized or not capitalized. This is for isolation. We put patients into isolation when they have diseases that can spread to other people. That's generally when they'll be isolated. So in elderly, there's a disease that kind of passes through the population. It's called C. diff, and it winds up causing a lot of nausea, diarrhea, dehydration, that kind of thing. So thank you for listening in, and I will catch you on the last video of our week.